Hey everyone, Dr. Amy here with you guys today. Welcome to another Recovery of the Month with Fortress. Thank you for joining in. Again, just to reiterate, these routines are here to be a free resource for you and perform at your own discretion. This does not replace any healthcare advice from me or even from your own healthcare practitioner, as well as physiotherapists or any other healthcare provider. So today's routine is going to be a little bit more hip focus. I have my whiteboard off to the side that you can't see. So somewhere between 2 to 4 rounds, pending your time constraints. We are going to do 4 different movements that kind of lead one right into the other. So again, this is going to be a little bit more hip focused as well as lower back to tap into that as well. First movement, we're going to get into this wide stance, or this like real sumo stance. I call these straddle hip drives. So I'm going to show you from the front and then show you from the side, or kind of like a profile view. So we want to get kind of wide as possible, like how a sumo stance wrestler would stand. And we're going to bend forward and gently, starting with the knees bent, we're going to gently straighten our legs as much as they can tolerate. And I like to get my hands a little bit wider. So here is what these standing hip drives mean. I like to think if my pants had the hip front pockets, I'm going to maintain my knees to stay straight, and I'm going to try to drive my right hip pocket towards the center of the floor. So I'm going to hold, go back to center, and then alternate the left hip pocket to drive to the ground. Perhaps you should feel maybe some inner thigh kind of strain or stretching in a good way. We're going to alternate back and forth, and you might, obviously, since we're in this bent position, feel the back of our legs or hamstrings, get some good stretch through there. So a total of 20. I just chose 20. And we're really trying to just tap into newer range of motion with every rep. As you rotate from side to side or keep switching, perhaps now I have my right hip driven to the ground. This leg's probably going to get a little bit more straight. My opposing leg might have slight knee bend. And then when I switch, same thing. I should feel that sensation. I'm going to do a couple from the side so you can see kind of like this profile view. Again, that wide stance. My hands are going to be kind of wide. I'm supporting myself still here. I'm going to drive my left hip pocket, front pocket to the ground. Switch. So maybe like a 2 or 3 second pause. After that, this is going to lead into our next movement. Still in the straddle position, we're going to go into kind of like a rotation reach. So still in our sumo stance or straddle pose, I'm going to place my left hand in the center. I'm going to place my other hand, or my right, behind my back. And I'm going to try to plant and push and rotate behind me as best I can. Just kind of in and out. Trying to keep my knees straight. I'll do a couple here. So 10 on the right, 10 on the left. I like to have my eyes follow the way that I'm turning, and I'm driving. I'm pushing through the ground to try to gain new range of motion. I'm going to do some on the other arm, but we're going to do 10 on the right, 10 on the left. I'm going to show you from this side. So I'm going to switch sides. Right hand's on the ground. Left hand is in the small area of my back, my lower back. I'm pushing that ground away. I'm trying to rotate to the ceiling. Try not to let those knees bend. And you might have one side that's a little more, I guess, mobile than the other. And I'm just going to turn to the front so you can see. I'll do a couple reps on each side. I probably have one side that's a little bit more mobile than the other. I'm going to go back to my first arm here. Again, my right arm is at the small of my back, pushing that ground away as I rotate. I'm going to do about 3 here just for demonstration. That's 2. Also, my hand that's planted clearly. I'm keeping that elbow straight as well, and I'm pushing the earth away. Man, when I rotate to this left side, I can feel that mid-back in between my shoulder blades. Kind of get some stretch. All right, so 2 more movements after this. Our next one is repeated back bends in standing, or in the PT world, we call them repeated extensions in standing. I like to kind of put my hands on my hips, kind of like so. Like, all of us have these like little dimples in the back of our pelvic bones. Those are the SI joints. I like to kind of just put my hands right on my butt cheeks right next to it. And all we're gonna do, as best we can, we're using our hands as kind of like a lever to push us forward a bit. It should be comfortable, but all we're doing is bend backs. So this is what they look like from the side. We're gonna do 10 of those. Just kind of pressure on. Oh yeah. Pressure off. Pressure on. Every rep I'm gonna do, I'm just gonna try to get further and further. In this case, I am gonna try to keep my knees locked out or just slightly bent. But really, the main feel is your hands act as a lever, and it's almost as if you have like a little towel roll in your lower back. It should feel comfortable. Pressure on. Might do a little exhale at the end. Pressure off. I'm going to do 2 more after this one, but we're going to shoot for about 10 reps on this. 1 more for good measure. And then our last movement, typically termed in the strength and conditioning world, Russian baby makers. I don't know why they call it this, but whatever. So you're gonna get into your squat stance, probably maybe a little bit wider rather than feet directly underneath our hips. We're gonna tuck our fingertips underneath our toes, like so. And my goal is to get into a squat position. So I'm gonna pull myself into this squat, kind of like bring my pelvis forward, pressure on, gently drive my hips up. And I'm gonna shoot for 10 reps on this. So essentially, I'm just pinching my toes to help me counterbalance my center of gravity. And you might kind of finagle your squat stance. Maybe you go a little bit wider, right? Because everybody's hip sockets are angled differently. Driving that pelvis forward, getting a wide hip pocket here. I'm gonna show you from like this profile view. Again, I'm gonna tuck my fingertips or kind of grab my big toes, pinch them. I'm gonna drive my hips down into a nice deep squat. Drive the hips up. I'm gonna do 2 more after this. If you hear some little crickling, those are my knees. That's okay. It's non-painful. All right, so that is today's routine, 4 different movements.